I'm Susan Cole from Phoenix Health Movement, and unfortunately my co-host Dennis Onyango isn't able to join today, but I'm thrilled to be joined by two truly phenomenal guests who were both featured speakers at the AIDS 2026 conference. Our first guest is Alberto Pereira Jr., a Brazilian journalist, director, and television presenter who was Master of Ceremonies at AIDS 2026. As a Black gay man living with HIV, Alberto uses his platform to spark important conversations about race, LGBTQ plus rights, representation, and HIV in Brazil. And then after we hear from Alberto, we'll be joined by Paulie Amanita Calderón-Cifuéntes, a Colombian scientist and trans rights advocate with more than a decade of experience in HIV advocacy, drawing on both her lived experience and her scientific expertise. She works to ensure trans communities shape HIV research, policy, and the decisions affecting their lives. So let's bring on our first guest. Fingers crossed, Alberto is going to be able to join us.
Hello.
Hello, Alberto. How are you?
I'm fine, and you? Thank you for
I'm
having
very
me in your
well.
show.
It's absolutely wonderful to have you, and I'm so starstruck to have you because you are absolutely brilliant as the host of the opening ceremony. It was so powerful, so brilliant. And as Masters of Ceremony at the conference, what did the experience mean to you personally, and what stayed with you the most from the conference?
Well, it was my second conference. I was in 2024 in Munich, in Germany, but I was not in the same position. So I was with a NGO there in Munich, interviewing people, get to know people from other countries, and bringing and building community. This year in AIDS 2026 in Rio, I was in my home. I'm Brazilian, so I was feeling more comfortable, of course. But then this invitation to be the Masters of Ceremony, and I was very moved because it's a huge platform and it's a huge opportunity to address some important topics about living with HIV, being a Black gay man in Brazil, and I think that what makes me more happy about it because it was the organization give me the freeness to talk about whatever I want in the first speech. Yeah, I could really create and think what I would like to address, and I think it was very important because being a Black gay man in Brazil, and like we're gonna discuss further, the HIV achieves Black people much more than the other populations. And here in Brazil, we are majority of the population. We are 56% of Black people in Brazil. But in new case of HIV, Black people are 60%. So we need to address this topic because inequality it's affecting the treatment and everything.
No, absolutely. And one of the things that really stayed with me at the conference was a session about racism and HIV. Thiago, have I said it Cruz? Have I said that correctly?
Yeah,
he spoke about Black people in Brazil experiencing worse health outcomes across nearly every measurable indicator. While there is a myth that Brazil is racially equal, we continue to see these inequalities. Why do you think Black communities are disproportionately affected by HIV in Brazil, and what actually needs to change?
Well, we need to address the racism and
Mm,
what comes after that, because we had like almost 4 centuries of slavery
mm,
in Brazil. So after we ended that, black population was abandoned. We didn't have
mm,
any reparation laws or any help from government. So all the black community had to do it for themselves. So
mm,
we most of us live in far away from from the center of the cities. We have less opportunities to study. The areas where black communities live there, less of health programs, less of help of uh, things from the government, like people don't have access to, for example, water sometimes. So yeah, and because of that, of course, in the prejudice, black community never was like in they never was uh, they never thought that they had to they think about what they're gonna do for their life. They try to help each other, but don't have support. And because of that, and because of the prejudice, we suffer. People don't take care enough of the health. They don't get a good education, and because of that, in a issue as HIV, there is involved with uh, stigma, and HIV during a lot of times in Brazil and the world was only addressed as for LGBT community, but it's
mm.
not. And because of that, the straight people from the black community don't do the examinations. They don't are encouraged to do testing and etc. That's why we have these numbers.
Absolutely, and I think that we see very similar situation in so many countries, like even within the UK. Lots of people from black communities don't think that HIV is something that's going to affect them, but also, as you say, it's all the other intersecting issues that we've got going on in our lives, and the racism that so many people face. It's understandable why lots of people may not want to engage with the health service. So it's so important that you are raising these issues, and the impact that you're having in Brazil and worthwhile is fantastic. So thank you
Thank
for
you.
everything you're doing.
And I think that I'm part of a huge community that are fighting for the rights, fighting for more investment. So I think we are constructing
Yeah.
the path for the future.
Fantastic. And Brazil is actually leading the way in many aspects. I mean, what role would you say that Brazil can play in strengthening the HIV response across the global south, particularly around issues to like access to treatment and new prevention technologies? Because we are still seeing
Yeah.
significant inequities in the global south.
Yeah. Since 1996, here in Brazil, the treatment is free and universal. So everyone in Brazil, even foreigners that are in Brazil for vacation or living here, can access the treatment in SUS, our health system, public health system, and that make us okay. We can include all population, but if we don't encourage people to do the testing, to go to the doctor, and if we don't do our homework in house, how can we be a role model for the world?
Mm,
For I think we can maybe think that in case of Brazil, we can inspire other countries, like the investments in public health. We can also inspire other countries in the one attitude that we had in the past. We pressure the companies in order to have a better access and cheaper medication. And we did it in the early 2000s, but we need to do again, because Lena Capovir, for example, we did tests in Brazil, but we are not included in the license for cheaper medication. So we need to do more pressure, in the international community, and maybe we need to talk more in the South Global. We need to look us like equals and come together and fight.
Absolutely. I think it's so important that we come together and fight. And it's shocking that we have had this tremendous progress, but not all communities are benefiting equally. And we're seeing these inequities both between and within countries. And it's fantastic that, we've got these new technologies, but unless everyone can benefit, we're letting the world down, and we're letting the people who need it the most down. But I think you're absolutely right that it's important that we.
In my speech on AIDS 26, access without technology without access is a privilege. It's not for everyone.
Absolutely, and that's something that really stayed with me from hearing you speak at the conference. I was really pleased to have been there in person to hear that, and I think it's really important that everyone hears that. I know sometimes these conversations can make people feel uncomfortable, like when we talk about racism and when we have these types of conversations, but it's absolutely crucial that we address these things so we can fix it. And you speak publicly about your HIV status as coming out of your last closet. What gave you the courage to do that, and what actually changed for you afterwards?
I got my diagnosis in 2009, and 10 years later, in 2019, I revealed public my condition as someone who lives with HIV. And what changed? What made me reveal my serology? I think that we are in 2019. We were facing a far-wing government here in Brazil, and our former president Bolsonaro was saying that one of the first things that he said when he got in the office, he was saying that we should cut the finance for some things, including HIV and tuberculosis, because we people who are living with HIV were we are at space. We don't have our disease. Our condition is something we need to take care, not the government. It's not something that the government should do. And this statement, it was very violent and provoke in society in Brazil. Bolsonaro in Brazil, he was racist. He is, because he's still alive, but in prison now.
Yeah.
And we need to say that, yes. And he is racist. He is. He provokes stigma against Black people, HIV people who live with HIV, against women. He don't like any other group other than white men. So we as society, we need to come together and fight. And I think that because I was always already addressing other characteristics of my Blackness, my sexuality in my work as a journalist and in TV director and presenter. So I realized that my whole career basically happened when I was a positive guy. I was living with HIV. So my diagnosis never stopped me, and I could thrive. I could realize my dreams. I married, and HIV was never an issue for me because I had the information. But some people don't have it, so we need to say it out loud. And I am Alberto Pereira Jr. I'm a proud Black gay man who lives with HIV, and this is who I am. And this won't define me, because I can do and I can be wherever I am.
Oh, Alberto, that's so powerful and so important. And as a Black woman living with HIV myself, I know how important it is when we share our our lived realities, and the fact, like for me, I've got 4 children, 2 before I had HIV, 2 after, and they're all HIV negative. HIV has never been a barrier to me living a full life, and I think it's so important that we get these messages across. And finally, what would you say to a young Black gay man who's just been diagnosed with HIV and is frightened for his future?
I would say that he is not alone. He's a part of a community. What more than 1 million people living with HIV in Brazil. So you're never alone, and you can find guidance. You can find respect. You can find good treatment here in Brazil, but you also can find love.
So important. Absolutely, you can find love. Alberto, thank you so much for coming on. It's been an absolute joy and a privilege to have you on the show.
Thank you for having me, and count on me, please.
Oh,
I'm
bless
here
you.
to work together with you, and we need to have more space like you have for talk about this.
I would love that. Thanks very much, and hopefully see you soon. Bye-bye.
Thank you. Bye-bye.
Bye. Wow, so inspirational. And let's bring on one of the most inspirational and glamorous people I know in the entire global HIV response, Amanita. Hello, looking.
Hi, Susan. How are you? So nice to see you again. And it's so nice to be in your show again. It's been years. It's been what, like 7 years since the last time.
Yeah, you were one of the first people that when I started doing broadcasts that I've had on, and then your ascent has been stratospheric. You're making such a huge difference to people living with HIV all around the world. So thank you for being you.
Thank you for inviting me, and thank you for the time that we spent in Rio was wonderful. In the
conference. It was so cool hanging out in Rio. That was great.
In the world. Paradise.
So at AIDS 2026, you gave your presentation, your keynote presentation, wearing the absolutely remarkable HIV unwrapped outfit designed for you. Can you tell us the story behind that and what you wanted to communicate?
Okay, so the keynote, the plenary was about the future of the HIV prevention. And the keynote was specifically about why gender affirming care for transgender people is, in fact, one of the central pillars of the HIV response. Because for us, gender affirming care, together with legal gender recognition and with non-discrimination or anti-discrimination laws, are basically the perfect cocktail that would lead to a drastic reduction in minority stress, drastic reduction on barriers for us to access HIV prevention, treatment, and testing services, linkage to care. And so when you put all of these things together, you drastically improve the quality of life of transgender people. And you just basically give us a chance to stand for ourselves, to protect ourselves, to adhere to treatments, and eventually to produce or to have much better and much better HIV outcomes. That was the main point.
That was Yes, and yet you articulated it beautifully, as well as looking absolutely
The
stunning.
dress was gorgeous.
It was so gorgeous. Did you get to keep it?
I didn't, because I'm actually, but there's a really good reason. So first of all, the dress was inspired in the goddess Huitaca from the Muiscan belief system from Colombia, from the community, the indigenous community that I come from, or at least that I have ancestry from. And this dress was so wonderful, and it just reflected so much the power of the HIV advocacy that communities do, that won a beautiful prize, and now it's going to New York to be presented in New York Fashion Week. So I didn't get to keep it, but it is going to be featured in New York Fashion Week. And I was offered to model, but I am not going to the United States, not even for Fashion Week.
No, I'm with you there. And Amanita, trans people, especially trans women, are disproportionately affected by HIV. What barriers do they face trying to access like HIV prevention, testing, treatment, and care?
Okay, let me just start maybe a couple of steps before. When in the world where we live, in a white supremacist, capitalistic, and patriarchal world, the more boxes you check of oppression, the more dehumanized you are. So if you are Black, if you're a trans woman, if you're a migrant, if you are poor, you are automatically more dehumanized, and therefore the entire systems that were created for cisgender heterosexual white men don't serve you. And so that comes with economical, political, social, cultural barriers that make it so much more difficult for example, Black trans women to have access to services that are fundamental for us to prevent HIV infection, to treat HIV. And so for this reason is that it becomes so exponentially higher, the prevalence of HIV among these populations. And I'm just going to quote a few numbers in here, if that's okay with you. The CDC, the Center for Disease Prevention and Control, in the United States, did a wonderful study from 2015 to 2019, trying to assess the prevalence of HIV among different key populations. And the numbers are staggering. 48% of the population of transgender people living with HIV in the United States was Black trans women. And then, I'm sorry, from transgender women were Black trans women. And from that same group of people, 35% were Hispanic or Latina trans women. That is 83% of transgender women of like being of color, the ones that are living with HIV, compared to a 10% of white trans women. Now, if you move to Europe in 2024, the European Center for Disease Prevention and Control did something slightly similar, but they didn't really include race in the assessment because, again, systems sometimes overlooked or invisibilized people of color, but they did look at migrants, and they looked at migrants mostly from the global south. And what they saw it was that it was 32.2% of migrants coming from sub-Saharan Africa and 24.4% of migrants coming from Latin America and the Caribbean, the ones that were diagnosed as HIV positive. This gives you a really, really, really strong idea of how intersectional it's race, gender identity, and migration status. Again, the more boxes you check, the more dehumanized you are, and therefore less access to services you have. The HIV outcomes then become way worse.
Absolutely. And we see that things are only getting worse globally with the rollback in rights and the hostility to trans communities in so many countries that we're seeing now. What action needs to be taken to change these shocking inequities that trans people face?
So let's first try to understand why is it that we're having such a strong backlash against the trans communities. And like on one hand, I genuinely believe that it's mostly due to the fact that we have become so incredibly visible in conversations in comparison to how visible we used to be.
Mm.
This is around 2015, when Caitlyn Jenner just came up in the cover of Vanity Fair, if I'm correct. Suddenly the conversation around transgender people became a lot more present, and this was seen in many different sectors, including the HIV response. UNAIDS, through the incredible advocacy of so many community members, finally managed to include transgender people within the 5 key populations that have the highest risk of HIV acquisition. And since then, a lot of work has been done to center all the different communities in the work that we're doing to respond to the HIV pandemic. Unfortunately, because of that huge visibility, we have also seen a strong pushback from the far right, from the anti-trans and the anti-gender and the anti-rights movement, quite often funded by, again, sexist or transphobic or racist organizations, or even governments. Let's just even talk about in the UK, where you're located, if I'm correct, the
Yes.
amount of people and funding that has been mobilized by people like J.K. Rowling that have ended up in restricting rights and excluding transgender people from things as simple as using bathrooms. Can you imagine? Susan, tell me the truth. Do you want me to be in the same bathroom with your husband? It makes no sense. Why would I be in the same bathroom with my husband, Susan? Why would I do that? It's just, I would rather be in the bathroom with you so we can do our makeup together.
Yeah,
right?
Absolutely.
All of these things are reflecting on this. And what do we need to do? Well, what we need to do is to continue organizing ourselves, continue advocating for community-led services, research, monitoring, policy making. We need to be present in as many spaces as possible. We need to resist, and we need to resist by coming in together, by preparing ourselves or making ourselves stronger through education, through access to services, to representation. We need more representation.
Absolutely. It's totally crucial that we have more representation. And Amanita, you've spoken openly about your lived experience of sex work. What changes do we need now to end the HIV inequities experienced by sex workers and put their rights and leadership at the center of the HIV response?
So, look, first of all, I've been very open and explicit about my lived experience as a person who does sex work, as a person who uses drugs, as a transgender woman, as a person living with HIV, as a descendant of indigenous communities, as a migrant. I think that what changed for me, let me ask a question, is what changed for me or what changes in general in the response? Because if I'm honest,
so just in terms of what changes would you like to see to actually end the inequities that sex workers and center them?
The reason why I am such a strong advocate for community-led services, community-led monitoring, community-led responses overall, right? It's because we are the experts of our own epidemic, of our own communities. No one knows better what is happening to sex workers from the global south in Europe than sex workers from the global south in Europe. We know best what is the lived experience. Therefore, we know best what works and what doesn't work. So when you give us a possibility to lead, when you give us a possibility to co-create and co-design from the very beginning, meaningfully and timely, instead of just being put in a position of advisors or consultants, we create the most cost-efficient, the most wonderful, most accessible, most radical, innovative services and programs and research and monitoring that there's to be seen. The NGO report from community-led integrated services that we presented at the United Nations Joint Program for HIV/AIDS from the UNGO delegation last December in Brasilia showed that. We just show many different case studies of what happens when you give the communities the power and the money, and you let us lead. And when you let us lead for real, and what you see is a radical impact and reduction of the HIV prevention, HIV prevalence among the communities. And so this applies to all of us. This applies to sex workers, this applies to trans people, to people of color, to migrants, to the MSM community, to the people of men who have sex with men. and the people and the community of people who use drugs. You need to let us lead and fund us.
Absolutely. And I'm really glad that you mentioned about funding us as well, because that's absolutely crucial. We need genuine leadership. We have to move away from this tick box tokenistic engagement that we've seen in the past. We need genuine leadership and to be funded properly for our time to get on and do the work that we know works best. Nothing,
Exactly.
and it's much more than nothing without us, nothing about us without us. We need leadership now.
Mm-hmm. It's nothing about us without us in the leadership.
Yeah, absolutely. Thank you so much, Amanita, for coming on. That's just so lovely to have you on the show again after seeing you in person, and I hope I'll see you very soon.
For sure. I'm sure we will be doing a lot of things together. I'm very excited to see you again. And it was lovely to spend some time with you in Brazil.
Wonderful. You too. Take care. Bye-bye.
Bye, Suzanne.
Bye. Oh my goodness. And we have run out of time. I'd like to say a huge thanks to Alberto and Amanita for joining us, sharing their powerful insights. You were both absolutely wonderful. I'd like to thank Disruptive Live for their technical wizardry and making all of this happen. If you've enjoyed Positive Health, you can watch all of our episodes on the Phoenix Health Movement YouTube channel. Do please like, subscribe, share with your family and friends and networks. And I will be back with Dennis for another episode soon. So until there, take care and see you soon. Bye-bye.